So we'll start with blood pressure. So first is come to the definition. Blood pressure is a lateral pressure exerted by the column of the blood. Blood pressure is a lateral pressure exerted by the lateral pressure is very important word by the column of the blood on the wall of the vessels. So here we are not mentioning any artery or veins or capillaries. It is vessels. So it involves everything जिसके अंदर भी blood column present है. Okay, so because of this definition we can differentiate the blood pressure into like so because of this, as it is not all vessels, so there we can hear the term like a arterial blood pressure. So blood pressure in the artery, or you can hear the term like a venous blood pressure. So that is a blood pressure in the veins, arterial blood pressure, ventricular blood pressure. So that we can have different. So but whenever I will mention only blood pressure, it means we are talking about arterial blood pressure. If it doesn't specify, अगर मुझे venous blood pressure के बारे में बोलना होगा, then I will use word venous blood pressure. But whenever I will use just simple blood pressure without any prefix suffix, then it means that I am talking about arterial blood pressure. Okay. So इसके बाद जब भी मैं blood pressure बोलूँगा, so it means that it is a arterial blood pressure. Now when we want to examine the blood pressure or we want to check the blood pressure, it is not a constant. So it varies with the cardiac cycle. जब heart contract होगा, that time there will be increase in the blood pressure, and at the same time when it decreases, when the heart relaxes, ventricle relaxes, or in a diastole, then there is a decrease in the blood pressure. Since it is not very constant, so there will always blood pressure will keep on increase and keep on decrease, increase and decrease. So which blood pressure is at the high peak side, we call it as a systolic blood pressure. So how we can define the systolic blood pressure? It is maximum arterial pressure which can be measured during systole. So हम systole check नहीं करते. हम जो maximum blood pressure measure कर रहे हैं, we'll consider that is occurring only through the systole. So maximum pressure which can be measured is systolic blood pressure, and it is a major function of systolic blood pressure is because of cardiac output. So systolic blood pressure is directly related to the cardiac output. जब आपका cardiac output बढ़ेगा तो आपका systolic blood pressure बढ़ेगा. जब cardiac output कम होगा तो आपका systolic blood pressure कम होगा. Normally, if you see the range of the blood pressure, it ranges from 100 to 130, or some books has given 105 to 135 mmHg. So always mention mmHg. It is millimeter of mercury, because we are using the instrument sphygmomanometer. Sphygmomanometer contain the mercury. अगर आप कोई ऐसा इंस्ट्रूमेंट यूज करें जिसमें वाटर यूज हो रहा है तो यू कैन टॉक अबाउट वाटर आल्सो, बट हियर we commonly use a sphygmomanometer, so we are always mention it in the mmHg. And since this systolic blood pressure is a function of the cardiac output, and cardiac output keep on changing, it's a very dynamic entity. So with a small excitement also there will be increase in the cardiac output. So that's why systolic blood pressure is always keep on fluctuating. So there is you can see day-to-day variations. Early morning there is a low systolic blood pressure. As the evening goes, there is increase in systolic blood pressure. If you saw someone who very angry, then that can increase your blood pressure. Change with the situations, excitement, emotions, or if you want to do exercise, that keep on changing the blood pressure. So it always fluctuates with the varieties of situations. It is normal for the individual. Then come to the diastolic blood pressure. It comes at the lowermost portion of the blood pressure. So blood pressure is the lowest blood pressure which can be measured, or minimum blood pressure which can be measured by the sphygmomanometer, and that is usually occur during diastole, is called as a diastolic blood pressure, and it ranges somewhere around 60 to 90 mmHg. And basically diastolic blood pressure is direct function of, or directly related to the peripheral resistance offered by the vessels. So जो भी resistance to the blood flow is offered, that will affect the blood pressure. And the factors which affect the total peripheral resistance is like a vascular diameter, viscosity of the blood flow, and these are quite a constant factors. So it will show very less fluctuation in the systolic or diastolic blood pressure. So in day-to-day variation, there is only changes in the systolic blood pressure. Diastolic blood pressure usually doesn't change and is almost constant. So whenever there's, if you see the high systolic blood pressure, high diastolic blood pressure, then it might be concern for you. So you need to investigate more that there might be patient is suffering from the hypertension. So whenever there's increase in the blood pressure, that condition we call hypertension. Whenever there's decrease in blood pressure, that condition we call it as a hypotension. Now conventionally, how we write the blood pressure? We'll write a systolic blood pressure on upper portion and diastolic blood pressure at the denominator. And this is how we'll always write. So whenever you say anyone written 120 by 80, he doesn't have to mention 120 systolic or 80 diastolic. It always mention as it is that he's telling about a systolic and diastolic. Second thing, as there is a difference between systolic and diastolic, there are two another terms has been come. One is a pulse pressure. And pulse pressure is a direct arithmetic difference between systolic and diastolic. It is like a systolic blood pressure minus diastolic blood pressure is equal to pulse pressure. And this will gives you idea about a stroke volume. So whenever there is a stroke volume, there is a increase in pulse pressure, and it is also indication of the systolic hypertension because of there is a decreased elasticity of the blood vessel. So whenever there is decreased elasticity of the blood vessel, there is a high variation in the systolic and diastolic blood pressure. Then another important term will come is the mean arterial pressure, which we usually doesn't use in clinical life, but it is very important, which is we use in physiology. It is the average blood pressure which measured throughout the cardiac cycle. So here we'll measure the blood pressure millisecond to millisecond throughout the cardiac cycle, and we'll take its average. And that average blood pressure is a mean arterial pressure. And why mean arterial pressure is so important in physiology? Because all our regulatory mechanisms, all our reflexes and all our feedback control mechanism, they respond to mean arterial pressure. They doesn't respond to systolic or diastolic. They respond to mean arterial pressure. So now this is what our one cardiac, there's increase and then there is a decrease. So if you see this is one cycle, this is start with one diastole, this is start with another diastole, and this is systole. So here we'll keep on measuring this blood pressure throughout the cardiac cycle, millisecond to millisecond. And this all number of blood pressure which we have measured, that we'll calculate, add it, and जितने times हमने किया उतने times को उसको divide करेंगे. That will gives you average cardiac blood pressure. That is a mean arterial blood pressure. But problem we use the blood pressure with sphygmomanometer, and sphygmomanometer we cannot use this minute to minute blood pressure. Here we can use only maximum and minimum blood pressure. So to measure this minute to minute or real time blood pressure, we need to put a catheter into the artery and attach that catheter to the pressure transducer or sphygmomanometer, and there you'll get that minute to minute pressure calculation. Then you can calculate a mean arterial pressure. But it is very invasive process, and we don't want to do this process with the human beings and not with every patient. So we can roughly calculate mean arterial pressure. And how? If you see the cardiac cycle, the systole is for 0.3 second and diastole is for 0.5 second. If we make it roughly, so systole is for 1/3 of the total time, while diastole is for 2/3 of total time. So we'll take average blood pressure is like a 1 systolic blood pressure plus twice diastolic blood pressure. Because throughout the cardiac cycle, half portion will be the systolic blood pressure and 2 portion will be the diastolic blood pressure divided by the 3. That will give roughly equal blood pressure to the mean arterial pressure. This is what normally we use the formula for the mean arterial pressure, blood pressure. How we write the mean arterial blood pressure? Mean arterial pressure is equal to MAP. Okay. Now if you see here, sir, आपने इधर तो कुछ और ही लिखा हुआ है. Here something else written here. Now here what will happen? We'll put a formula of pulse pressure. Systolic blood pressure, pulse pressure is equal to systolic blood pressure minus diastolic blood pressure. So here what how we can calculate diastolic blood pressure? Sorry, systolic blood pressure. Systolic blood pressure is equal to pulse pressure plus diastolic blood pressure. That value we'll put here, and here instead of this here we can make it like a pulse pressure plus diastolic blood pressure. That will is equal to pulse pressure plus thrice diastolic blood pressure divided by 3, and that will give us a formula similarly, diastolic blood pressure plus 1/3 of the pulse pressure. So why this formula is mentioned in the book more than like this formula? Because it just shows that the mean arterial pressure is more dependent on diastolic blood pressure and only 1/3 dependency on systolic blood pressure. So it does depend on systolic blood pressure, but the more contribution is by diastolic blood pressure. So there is a very much dependence on diastolic blood pressure. So a small change in the diastolic blood pressure will cause a change in the mean arterial pressure, while for a systolic blood pressure to make the change, there has to be a big difference in the systolic blood pressure. Then only there will be the little bit change in the mean arterial pressure. Now, if you see the normal value of mean arterial pressure is somewhere 93 mmHg, and if you see the range is somewhere around 90 to 100 mmHg. So, when our blood pressure, mean arterial pressure, blood goes above 100 mmHg, we call it as hypertension, and when it goes below 90 mmHg, we call it as a hypotension. Okay, सब समझ में आ गया? Now, before going for a determinant of the blood pressure, so this will put a arm. It is not a left arm. We'll usually we can put on any arm, but we usually put it on a छोटे finger, right arm. We can measure in both right and left arm, but normally position is we usually stand on the right side of the patient. So we usually measure blood pressure on the right arm. Okay, and we'll apply the BP cuff here. We call that pad BP cuff. Okay, and if you feel that pad, it is made up of the cloth, but inside the cloth it is made up of latex, or you can call it the fibers. So the fiber cloth which is actually exert the pressure, the fiber packet which is actually exert pressure, it is connected to the sphygmomanometer and pump. जो ball होता है उसको pump बोलते हैं. Okay, and there is a screw which can regulate the air flow. हम उसको बंद कर देंगे तो सीधा पंप से फ्लो अंदर जाएगा. If you release it, then air flow can release. Now what we'll do, first we'll take the pulse on radial artery, and then we'll raise the pressure. BP cuff यहाँ पे पंप को एक लगा के रखा हुआ है with a screw, and this will be attached to the sphygmomanometer. Okay, and we'll feel the pulse and we'll keep on increasing the pressure. और कब तक प्रेशर बढ़ाते रहेंगे? हम पल्स फील करते रहेंगे जब प्रेशर बढ़ा रहे. Still, we stop the feeling pulse. And this is called palpatory method of blood pressure measuring. So जैसे पल्स palpate होना बंद हो गए, we'll increase थोड़ा सा उससे और ज्यादा प्रेशर बढ़ाएंगे, and then slowly we'll start releasing the pressure. And slowly जब pressure release करेंगे, sphygmomanometer नीचे जाता है, one point will come where you will actually start feeling the pulse, and that is the point where your blood pressure cuff in the BP cuff is little bit lower than actually pressure inside the artery. So principle is similar. जैसे अगर आप रबर ट्यूब में से पानी जा रहा है और आपको पानी का फ्लो बंद करना है, तो आप क्या करोगे? उस पर प्रेशर डालोगे रबर ट्यूब पे, और प्रेशर कितना डालोगे? मोर देन प्रेशर इनसाइड द वाटर, इनसाइड द ट्यूब. ट्यूब के अंदर जितना प्रेशर है उससे ज्यादा डालोगे तभी वो बंद होगा. When we are considering that tube is a flexible. Okay. Similarly here, we block the artery completely, means we are already increased the pressure above the artery. Now we slowly release, and one point will come where the pressure is now exactly little less or exactly equal to the pressure inside the artery, and then blood will start flowing into the artery and you will start feeling the pulse. This is your blood systolic blood pressure, where you will get systolic blood pressure. Okay, this is very important step. आप बहुत बार सिर्फ स्टेथो से डायरेक्ट करते हैं. That is called auscultatory method of the BP measurement. This is called palpatory method. But you should start with the palpatory method first. That will gives you upper limit of the blood pressure. कि systolic blood pressure तो इतना, it is roughly you are getting idea, but because of you consider the resistance offered by the elasticity of the blood vessels, muscles, bones, skin, all those things, then it is almost exact what pressure applied and pressure inside is almost exactly, and that will gives you idea about systolic blood pressure. Next step, what we will do now, you will release completely the pressure. We will put a stetho on the brachial artery. Brachial artery is somewhere here. We'll put a pressure on the brachial artery, stetho on the brachial artery, and now we'll keep on raising the प्रेशर. और कितना बढ़ाओगे? जितना आपका सिस्टोलिक ब्लड प्रेशर पाल्पेटरी मेथड में है ना, उससे 10 to 20 mmHg एक्स्ट्रा. 10 mmHg भी एक्स्ट्रा बढ़ा लो, कोई प्रॉब्लम नहीं, और 20 mmHg, एंड देन यू स्लोली स्टार्ट रिलीजिंग द प्रेशर. जैसे आप प्रेशर रिलीज करना चालू करोगे, सिंस देयर इज नो ब्लड इज फ्लोइंग, देयर विल बी नो साउंड. वन पॉइंट विल कम व्हेन द योर प्रेशर इनसाइड द कर्व इज little bit lower than pressure inside the artery. There will blood will start flowing, and that will produce the sound, turbulent sound, that is called Korotkoff sounds. And that first appear in the sound stethoscope will give you systolic blood pressure. Then you will continuously keep on releasing. The sound will keep on increasing in intensity. Then slowly it will start decreasing. It will become muffled, and then one point will come when you stop hearing the sound, and that sound is given you diastolic blood pressure. And this is how you will measure blood pressure in the patient. अब साउंड क्यों प्रोड्यूस होता है? किसी को आइडिया है?
Opening of the walls.
वॉल्स नहीं होते आर्टरीज में. बोलो बोलो.
Sir, please repeat the question.
साउंड क्यों प्रोड्यूस होता है जब हम बीपी का ये करते हैं?
Sir, opening and closing of the semilunar valves or the bicuspid
हम
valves.
ब्रैकियल आर्टरी में कर रहे हैं, सेमिलर वॉल हार्ट में.
Turbulence flow, sir.
हाँ,
प्रेशर रिमूव होता है आर्टरी से.
क्या 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 क्या?
प्रेशर रिमूव होता है आर्टरी.
हाँ, तो उससे साउंड क्यों आता है उसमें, वही तो पूछ रहा हूँ मैं. नो व्हेन योर
सर
ब्लड. ओके बोलो.
सर जब ब्लड फ्लो बंद हो जाता है आर्टरी में, तो उस पे सर सडनली ब्लड आने लगता है, तो इट क्रिएट्स अ टर्बुलेंस.
ओके
सो इसलिए हमको वॉइस सुनाई देती
ओके. और फिर वॉइस बंद क्यों हो जाता है?
है. सर वो वापस लेमिनार फ्लो में आ जाता है ना सर.
हाँ,
Artery collapse कर जाता है.
अभी अभी सही ट्रैक पे आए हो. Now what happen normally if you auscultate the artery, you will not hear any sound. Why? Because in normal blood flow there is a laminar blood flow. Laminar blood flow मतलब कैसा होता है कि आर्टरी है आपकी, और इसमें पेरीफेरी में बहुत स्लोली ब्लड जा रहा है और सेंटर में बहुत फास्टली जा रहा है. सो देयर इज अ लैमिनार टाइप ऑफ द ब्लड फ्लो. इट इज लाइक अ बड़ी नदी जैसे मूव करती है ना, तो एक्चुअली इट्स मूविंग, यू फील दैट इट इज नॉट मूविंग एट ऑल एंड इट विल नॉट मेक एनी साउंड. So because they are moving in laminar flow, when you are moving with a like a big flow, so in artery also it is laminar flow that doesn't produce any sound. Okay, first understand is why there is no sound in artery. Now what happened? What we are going to do? We are going to occlude the artery completely, and when turbulence will create, either there is increased blood in the small lumen, और नॉर्मल ल्यूमेन में ज्यादा ब्लड फास्टली ब्लड फ्लो हो रहा है तब टर्बुलेंस आएगा, या नॉर्मल स्पीड से ब्लड जा रहा है स्मॉल ल्यूमेन में से तब टर्बुलेंस आएगा. तो हियर व्हाट वी आर डूइंग, when we are increasing the pressure, so this is like a, okay, यहाँ पे हमने पूरा now this is just I'm trying to show the diagram. Now what happened जब हमने blood pressure पूरा normal pressure से above कर दिया, this is the pressure wave. Can you understand? This is the pressure wave. और जब मैंने blood pressure पूरा बढ़ा दिया है तो there is no flow. Since there is no blood flow, there is no sound. Now what happened whenever the थोड़ा सा sound open हो गया तो यहाँ पे blood आना चालू हो गया, यहाँ पे blood flow आना चालू हो गया, and that now blood flow is moving through very थोड़ी सी artery open हो रही है, that with fast it moving, and that creates turbulence and that will produce sound. That is a Korotkoff sounds. अब जैसे जैसे हम प्रेशर बढ़ा रहे हैं तो ब्लड फ्लो बढ़ रहा है तो उसके लिए साउंड की इंटेंसिटी भी बढ़ रही है, बट आफ्टर सम टाइम्स साउंड की इंटेंसिटी धीरे धीरे कम होती है. अभी ब्लड फ्लो मैक्सिमम आ रहा है बट ब्लड इज मूविंग इन फर्स्ट पोर्शन, इट इज मूविंग ओनली थ्रू द सिस्टोलिक प्रेशर बिकॉज प्रेशर इज ऑलवेज अबोव द डायस्टोलिक. आर्टरीज में कभी भी सिस्टोलिक सॉरी डायस्टोलिक के अबोव सिस्टोलिक के कम है, तो ब्लड इज मूविंग ओनली थ्रू ड्यूरिंग द सिस्टोल. डायस्टोल में ब्लड नहीं मूव हो रहा है, तो सिस्टोल में ब्लड मूव हो रहा है तो ज्यादा अमाउंट ऑफ ब्लड इज मूविंग, दैट कीप ऑन क्रिएटिंग टर्बुलेंस. बट मोमेंट आवर प्रेशर गोज above the below the diastolic blood pressure, now artery is completely open, it doesn't squeeze, it is completely open, and now there is blood is moving in systole also and during diastole also. So as it moving in both systole and diastole, there is normal amount of the blood is moving through the same amount of the lumen, and that will create again a laminar flow and that will not produce sound. And that's why जब शुरू में हमें साउंड आता है we call it a systolic blood pressure because our pressure is just little bit lower than we applied pressure just little bit lower than the systolic blood pressure. That's why we call it a systolic blood pressure. Similarly, when we stop hearing the sound, here our pressure is just lower than diastolic blood pressure, and that will help gives you diastolic blood pressure. Now every time when I am saying it is just lower than systolic and just lower than diastolic, तो हम इसको systolic diastolic क्यों बोलते हैं? Because there are resistance offered by the cuff, skin, soft tissues, and that's why whatever we are measuring the blood pressure is almost exactly like to that of the diastolic blood pressure. And almost all our clinical studies and all we are doing with that resistance, and that's why that resistance will be nullified. अगर किसी का जो 110 है हम उसका 100 मेजर कर रहे हैं, जब उसका 120 होगा तो हम 110 मेजर कर रहे हैं. So there is a increase in the blood pressure in the same proportion. So that will not make much difference in your diagnosis or treatment. Okay, so that blood pressure we always consider normal. Now, what are the factors which determine blood pressure? So the factors which determine, I'm not talking about factors which affect the blood pressure. Factors which decide our blood pressure are two important factors. One is cardiac output and second is peripheral resistance. And these both are called the determinants of the blood pressure. कार्डियक आउटपुट बढ़ेगा तो आपको सिस्टोलिक ब्लड प्रेशर बढ़ेगा, पेरिफेरल रेजिस्टेंस बढ़ेगा तो आपको डायस्टोलिक ब्लड प्रेशर बढ़ेगा. नाउ इफ यू स्प्लिट द कार्डियक आउटपुट इज डायरेक्टली रिलेटेड टू द हार्ट रेट and stroke volume. So whenever there is increase in heart rate, there will increase in the cardiac output, there will increase in the blood pressure. Similarly, when there is increase in stroke volume, there is increase in the cardiac output, that will cause increase in the blood pressure. Similarly, if you see the peripheral resistance is directly related to the diameter of artery. And the artery का diameter बढ़ेगा तो resistance कम होगा, and that will decrease blood pressure. Arterial का diameter कम होगा तो resistance will increase, and that will increase in the blood pressure. Apart from this, peripheral resistance is also depend upon the viscosity of the blood. So whenever there is increase in viscosity, there will increase in resistance, there will increase in the blood pressure. Also on the elasticity of the vessel wall. So if vessel wall is elastic, then there is a normal blood pressure. Whenever there is a decreased elasticity of the vessel wall, it will increase in the blood pressure, and also velocity of the blood flow. High velocity of blood flow will have high resistance, low velocity of blood flow will have low resistance. So these are the various factors which determine our blood pressure. So one is a cardiac output and is also called as a central factor. because it's related to the heart rate and stroke volume. And peripheral resistance is also considered peripheral factors, in which involve blood vessel diameters, condition of the vessel wall, viscosity of the blood flow, and viscosity of the blood and velocity of blood flow. Now, what are the various factors which affect the blood pressure or affect the determinants of blood pressure? First, we'll talk about heart rate. So, whenever there is increase in heart rate, it can increase in any condition like emotion, stress, or whenever sympathetic activity increase, that will the increase in heart rate, that will increase blood pressure. But whenever there is increase in heart rate, it conversely increase the timing for the diastole. Diastolic time is compromised in cardiac cycle whenever the heart rate increase. So systole is 0.3 second and diastole is 0.5 second. So this is normal for 72 beats per minute. Now, but suppose you had now 100 beats per minute, means your cardiac output will be for 0.6 second, and in that case your systole will be 0.3 second and diastole will be also 0.3 second. So diastole is get compromised, and since diastole get compromised, there will be less time to feel the heart. So the venous return will be decreased. Heart will fill with a very less amount of the blood flow because it will fill only with the within up to only 0.3 second, and that will compromise stroke volume. So whenever there is increase in heart rate, there will be concurrently decrease in stroke volume. That will little bit causes nullifies the effect of the heart rate on the cardiac output. Similarly, whenever there is increase in stroke volume, see it will need more time to fill the fill the ventricles. So reversely, it will decrease the heart rate, and this is how it will cause nullify the effect. So they both work together. So whenever we want to increase blood pressure, we need to increase heart rate and stroke volume simultaneously. How we can do? We can increase heart rate, that will increase the speed of the blood flow, and at the same time we can increase the force of contraction of the muscles, and that will pump the extra blood, which always usually normally present with the end systolic volume. Now there is less end systolic volume will present, and now there will be extra cardiac output will come, and that will extra blood will again return back, and that will slowly it will build the high stroke volume. Then there is a elasticity of the arterial wall, arterial vessels, or all blood vessels. At the time of the birth, the elasticity is the maximum, and damage to the vessel wall will start immediately after birth. So जो आप atherosclerosis बोलते हो, immediately after birth will be started and will continuously in progress till your death. But speed of the progress can be manipulated. It can be decreased or increased depending upon your lifestyle, your food habits, and other genetic factors. It can we can increase the progress of the stiffness of the arterial wall, or we can decrease the progress. And because of that, some individuals get hypertension early in the life, and some individuals get hypertension a little bit late in the life. But you will definitely get a hypertension. And since the elasticity will causes a resistance in the blood flow, it is usually causes high diastolic blood pressure. And it is the increased systolic blood pressure will affect the elasticity, and it also characterized by the increased pulse pressure. Then come to the arterial blood volume. It is like increase in the blood flow or blood circulatory blood, and that can increase our blood pressure. And whenever the decrease in the blood volume, that will decrease our blood flow. Then come to the peripheral resistance. It is usually related directly to the diameters of the blood vessels, more specifically arterioles. And arterioles are the most important high resistant blood vessels. So small change in the arterial diameter will cause a huge change in the peripheral resistance, and that can cause change in the blood pressure. So when there is a decrease in diameter of the arteries, it will increase blood pressure. Now come to the physiological factors of variation which affect the blood pressure. So age, immediately after birth, the pressure will be somewhere around 40 mmHg, and then slowly start rising the blood pressure, and it will come by the end of the 1 month up to 80 mmHg, and will attain the adult blood pressure by the age of 17 mmHg, that is 120 by 80 mmHg. And after that, it slowly start increasing, and we can get a maximum blood pressure 60 to 90, which consider normal value for the age of the 70 because of decrease elasticity of the vessel wall. Then sex. Good question. Someone asked me, is there any difference between heart rate and pulse rate? Normally, we'll consider this both are the same. But if there is a condition, we call it a mitral pulse deficit or heart pulse deficit. Here, apex pulse deficit. Apex pulse deficit. That apex pulse deficit is a condition where we measure the heart rate by directly using the stethoscope, and we measure the pulse rate by the finger. So we measure the heart rate by using the stethoscope on the apex, and we measure the pulse rate by radial pulse, and we'll see the difference between the heart rate and pulse rate simultaneously. And the water difference is coming, we call it as the apex pulse deficit. If it is more than 15 beats per minute, then we'll consider it as clinically significant. It happens in various conditions like aortic stenosis or also in a pericardial effusion. Here we'll get a apex pulse or a heart rate is little bit higher as compared to pulse rate, and also in a bronchial asthma. In that time also, many times we'll not get a pulse when a patient in a deep inspiration, and that causes we'll not able to feel the pulse in the radial artery, and that difference is called apex pulse deficit. That is a rare condition, but we usually could able to diagnose these rare conditions and life-threatening condition in the person. So we should always measure heart rate and pulse rate separately. And if you see difference more than 15 beats per minute, then you should counter check with simultaneously measuring pulse rate and heart rate. Okay. Now we'll see the factor. Another factor is the sex. So male has a little bit higher blood pressure as compared to female. Before menopause, after menopause, they almost female has a little bit higher blood pressure as compared to male. Why? It is because of the estrogen. So female has a high concentration of the estrogen before menopause, and that is having a good effect on the arterial vessel wall and maintain the elasticity of arterial vessels, and that helps cardioprotective function of the estrogen, and that helps the female to maintain little bit lower blood pressure as compared to male. That protective effect will be removed after menopause, and that's why female has developed little bit higher blood pressure in the after menopause. The effect of male, immediately after male, there is increase in blood pressure. It is because of the increased sympathetic activity causes vasoconstriction in the rest of the body and causes dilatation in the splanchnic vessel. Then with emotions, there is increase in blood pressure, usually systolic blood pressure. With extreme temperature, there is an increase in the blood pressure. But when you expose to the very hot temperature, sometimes it can cause lowering of the blood pressure because of severe vasodilation of the skin. There is diurnal variations at early in the morning. There is a lower blood pressure, but in the afternoon, late afternoon, there is a higher blood pressure. Exercise, it is a quite complex mechanism, but there is a rise in systolic blood pressure, and when you go severe exercise, there is a fall in diastolic blood pressure. Then we can see effect of the gravity. If you're standing position, the blood pressure will slowly start increasing in the lower part of the body. So part which is below the heart will have a higher blood pressure, and part which is above the heart will have a little bit lower blood pressure. Then effect of posture, moment from lie down to stand up, there is a sudden fall in the blood pressure, but later it will correct it, and overcorrecting there is a little bit increase in the blood pressure. So within 30 to 60 seconds, there is an increase in blood pressure from lying down to supine. So lying down has a lower blood pressure, standing has a higher blood pressure. Then sleep, during non-rapid eye movement sleep, there is a decrease in blood pressure, but when there is rapid eye movement sleep, there is increase in blood pressure. Body build, obese person have higher blood pressure as compared to thin person, but this is not the rule. Okay. Then come to the pathological variations. So whenever there is increase in blood pressure, okay, before going this, we'll take a 5 minute break and then we'll start. So now we'll start with the pathological variations in the blood pressures. So first is the commonest, and that is hypertension. So there is an increase in the blood pressure persistently, then we call it as a hypertension. When the systolic blood pressure more than 140 mmHg and or the diastolic pressure more than 90 mmHg, then we call it as a hypertension. If in condition when there is only increase in the systolic blood pressure, then we call it as systolic hypertension. And in this case, as of diastolic is normal, it is increase in the blood pressure. So there are two types of the hypertensions. When we classify, one when cause is not known, and that is called primary hypertension, or also called as essential hypertension. And secondary when cause is known, and then we call it as secondary hypertension. Now come to primary hypertension, which is one of the commonest, and it has to happen with each and every individual as the age progresses. किसी को जल्दी होगा, किसी को बाद में होगा. It is because of decrease elasticity in the blood vessels, and they're always usually associated with the other risk factors like hereditary. If parents has a hypertension, then you also mean to be hypertensive. Obesity, lifestyle, stress, smoking, drinking, all these factors will accumulate and increase the risk of developing hypertension. The secondary hypertension, when we know the cause, and if we know the causes, there are different conditions which involve. Like if cardiovascular system is involved, then cardiovascular disease can cause hypertension, that is atherosclerosis. The renal diseases where like a kidney is not functioning properly, like a glomerulonephritis or a juxtaglomerular tumors, which causes excess secretion of the renin, which can lead to formation of angiotensin 1 and 2, and that can cause hypertension. Then endocrine diseases like hyperaldosteronism, pheochromocytoma, Cushing syndrome, all these conditions will increase in blood pressure. Then thyrotoxicosis also causes increase in the blood pressure. Then diabetes also causes increase in the blood pressure. But that diabetes doesn't involve in endocrine function because insulin will not have a direct effect. It is the glucose concentration which has a direct effect on the blood pressure. Then neurological disorder, like increase in intracranial pressure, also causes increase in blood pressure. It is one of the reflex mechanism to maintain the blood flow to the brain. Then there is a one common condition where cause exactly not known, that is PIH, pregnancy-induced hypertension. So when you give a woman become pregnant, we should check her BP regularly, and even slight increase in the blood pressure should consider as alarm for the PIH, and patient should evaluate completely for a PIH. Then there's a one clinical condition where Goldblatt's hypertension. Goldblatt hypertension. It is also known as a renovascular hypertension. It's a condition when there is causes a vasoconstriction, or there is a decreased luminal compression of the renal artery, and there is decreased blood flow to the kidney. So it can affect both one kidney or both kidney. If there is only one kidney has a constriction, then it produces a blood hypertension, that is called a one kidney Goldblatt hypertension, and two kidney when there is a constriction occurring in both kidney, then also we call it two kidney hypertension. So how this occurs? So whenever there is a decrease, or when there is a compression of the renal artery, it leads to decreased blood supply to the kidney, and that will produce ischemia to the kidney. That will stimulate the juxtaglomerular apparatus. The decrease blood flow to the kidney will produce juxtaglomerular apparatus, and slowly it will start increasing the secretion of the renin by the kidney, and that renin will start increasing, and that will convert the angiotensinogen into angiotensin 1. That angiotensin 1 again goes and convert into angiotensin 2 in the lungs, and that will start developing severe vasoconstriction, and that will causes increase in blood pressure. Second thing, it also stimulates the secretion of the aldosterone by the adrenal cortex, and that again will start causing retention of the sodium and water, and that will again leads to increase in blood pressure. So even if it occurs in one kidney also, there is same mechanism. Even if it occurs in both kidney, then also same mechanism, and that will produce hypertension. Treatment of hypertension is, if you know the cause, like if you know atherosclerosis, we cannot treat, but other causes, if you know, you can treat the cause and you can cure the hypertension. But if it is a primary hypertension, we cannot remove the cause. So we can control the blood pressure. And how we can control the blood pressure? By changing the hemodynamics. We can increase the vasodilatation, we can increase the renal output and try to decrease the blood volume. And the different mechanisms are there, and by that those mechanisms like angiotensin 2 has a role in the blood pressure regulation. So we can use the drug which can block the angiotensin 2 and try to reduce the effect of the angiotensin 2 on the blood pressure. All those mechanisms we can contribute. That is called ACE inhibitor, which reduce the formation of the angiotensin 2. And there is angiotensin receptors inhibitor also that reduce the effect of the angiotensin 2 on the blood vessels. So by this mechanism also we can treat this patient. Now, another condition is a hypotension. It is called whenever there is decrease in the blood pressure, and whenever the systolic blood pressure is less than 90 mmHg, it is considered as a hypotension. And normally whenever blood pressure goes below 90 mmHg systolic, it's very difficult to measure the diastolic blood pressure. And that's why we usually diastolic blood pressure check करने के चक्कर में नहीं जाते. When blood pressure goes below 90 mmHg, we'll declare it as hypertension and we'll try to treat, because hypertension is always medical emergency. So there is a essential hypertension. This also can be primary hypertension, cause we may not know, and this may not be a life-threatening to the individual. But sometimes patient is very prone for the syncopal attack. थोड़ा सा भी गर्मी में खड़ा हो तो चक्कर आ जाए, थोड़ा भी स्ट्रेस हो जाए तो चक्कर आके गिर जाए. That can happen, but it may not be life-threatening. Secondary causes, when cause we know, like a myocardial infarction, neurogenic shock, or hemorrhagic shock, or hyperactivity of pituitary gland, or hyperactivity of adrenal glands, all this can cause a decrease in the blood pressure, and these are a case of emergency. So shock is a case of the emergency, and we need to treat this patient very, very aggressively. Then there's a postural hypertension. It is like, as we say, when you from lying down to supine, you get there is sudden fall in the blood pressure, then you correct it, and blood pressure will become little bit higher. So supine में कम blood pressure measure करता है, standing में ज़्यादा blood pressure measure करता है. But in some individual, this regulation of the blood pressure maintained by the autonomic nervous system is affected. So either the carotid body is affected or autonomic neuropathy is occurring, like as it can be happen in diabetic, and or if you are using like a beta 2 alpha blocker or beta blocker, then also it will affect the autonomic nervous system, and patient may prone for the postural hypertension. Now, when we are standing, lying down to standing position में जाते, there is a fall in the blood pressure, but it will not correct within the seconds. It will take time, and there will be decrease in the blood flow to the brain for more than a minute, and that will cause a sudden syncopal attack. Patient fall because of unconsciousness, and that is referred as a postural hypotension. You also might be experience this when you're suppose you're sick or ill, and you're lying on the bed for more than 2-3 days, and suddenly you get up. Then also you feel there's giddiness or anything. That is one of the example of postural hypotension. Treatment, if you know the cause, like if you're using some antihypertensive drugs, then change the antihypertensive drug the patient is not tolerable to. And If it is autonomic dysfunction like diabetic neuropathy and all those things, you can treat the diabetic neuropathy, or you can treat the cause, and it can improve the condition. Okay, so that's all for today. Any questions, any doubt?